I'm Muhammad Jassim, third stage in College of Medicine. I will talk about distribution of normal flora in the human's body. A human first becomes colonized by a normal flora at the moment of birth. In utero, the fetus is sterile, but when the mother's water breaks and the birth process begins, so does colonization of the body surfaces. Handling and feeding of the infant after birth leads to the establishment of stable normal flora on the skin, oral cavity, and intestinal tract in about 48 hours. This table for distribution of the normal flora in the human's body. The first, normal flora of the skin. The high moisture content of the axilla, groin, and areas between the toes supports the activity and growth of the relatively high densities of bacterial cells. The skin microbes are gram-positive cocci such as Staphylococcus epidermidis and Micrococcus species, and Corynebacteria such as Propionibacterium species. But of the Propionibacterium acnes, a normal inhabitant of the skin, becomes trapped in the hair follicle. It may grow rapidly and cause inflammation and acne. Normal flora of the conjunctiva. Staphylococcus epidermidis and certain coryneiforms, such as Propionibacterium acnes, are dominant. Staphylococcus aureus, some streptococci, Haemophilus species, and Neisseria species are occasionally found. There is little or no opportunity for microorganisms to colonize the conjunctiva without special mechanisms to attach to the epithelial surfaces and some ability to withstand attack by lysozyme. Normal flora of the respiratory tract. The nostrils are always heavily colonized, predominantly with Staphylococcus epidermidis and Corynebacteria, and often in about 20% of the general population with Staphylococcus aureus, this being the main carrier site of this important pathogen. The throat is normally colonized by streptococci and various gram-negative cocci. The lower respiratory tract, trachea, bronchi, and pulmonary tissue, is virtually free of microorganisms. Normal flora of the urogenital tract. The flora of the interior urethra are Staphylococcus epidermidis and Enterococcus fecalis and some alpha hemolytic streptococci. Some enteric bacteria such as E. coli, Proteus, and Corynebacteria, which are probably contaminants from the skin, vulva, or rectum, may occasionally be found at the interior urethra. The vagina becomes colonized soon after birth with Corynebacteria, Staphylococci, Streptococci, E. coli, and lactic acid bacterium. Normal flora of the oral cavity. Oral bacteria include Streptococci, Lactobacilli, Staphylococci, and Corynebacteria with a great number of anaerobes, especially bacteroids. At birth, the oral cavity is sterile but rapidly becomes colonized from the environment, particularly from the mother in the first feeding. Streptococcus salivarius is dominant and may make about 98% of the total oral flora until the appearance of the teeth. The eruption of the teeth during the first year leads to the colonization by Streptococcus mutans and Streptococcus sanguis. Normal flora of the gastrointestinal tract. In the upper GI tract of the adult humans, the esophagus contains only the bacteria swallowed with saliva and food. Because of the high acidity of the gastric juice, very few bacteria, mainly acid-tolerant lactobacilli, can be cultured from the normal stomach. In the proximal small intestine, there is lactobacilli and Enterococcus fecalis, while in the distal part of the small intestine, there is coliforms such as E. coli and relatives, and bacteroids in addition to the lactobacilli and enterococci. The flora of the large intestine colon is qualitatively similar to that found in feces, populations of the bacteria in the colon reach levels of 10 power 11 per ml feces, coliforms become more prominent, and enterococci, clostridia, and lactobacilli can be regularly found, but the predominant species are anaerobic bacteroid and anaerobic lactic acid bacteria in the genus Bifidobacterium bifidum.